Hello, and welcome to uh, the Eyes of the Conscious Soul supporting Education is the Best Medicine. Ms. Howard is at an event, and we'll be back next week. I want to thank everyone. I wish everyone again a happy new year, and may we have many, many more of them. Exciting time. Um, I'm blessed. Um, my family is blessed. My son, love him a lot. It's family for me too. It's really, really family, and I try my best to support that and understand the intricacies of trying to do that as a grandfather and as a father, uh, and a family and a friend and support and partner and all those kinds of things. So, I wanted to say good afternoon. This is Education's Best Medicine, and wanted to welcome everyone. Welcome the Facebook family. Appreciate you guys for hanging out and doing what you do. Like the support, and and we're trying to build more of a community focus in terms of particularly health education and education in general. Um, we I believe there's an attack on science and education, and we need to be mindful of that. Uh, and again, the special thank you to Marcus, a good friend who helped build the bones of education business, and now he's a married man with two beautiful sons and just a beautiful wife. I just want to thank him and always about him, always for him, and that kind of thing. Wanted to talk about a few things, and I think it's kind of important uh, having a collaboration between uh, thought provoking men of color. And so I've been talking about the relationship I've started to develop with Dr. Michael Lenore, Bay Area allergist, man of the year, doctor of the year, staunch supporter of community. And as we start to build this discussion about what we would talk about, and foundationally will be the shows that they will be doing what's called Health Minutes. And so within that piece, they'll bring you back to something like that has more content and more uh, discussions. So that's what this is about, discussion. This is by no means a medical service. Please, this is all informational. Please contact your health professional to have more discussions about these issues. And with that, I wanted to talk about and say a little thing about models, healthcare models. What do they mean? It's the way that healthcare is conducted in the system. And I've kind of always tried to study and understand models because I think that's the most efficient way of providing services. For example, one-stop service where an individual can get medical as well as mental health services at the same site, and especially referrals from the same site, especially care from the same site. So one of my old adages is, you tell me how my client gets to this facility, and I'll tell you if they're going to make it or not. If they've got a transportation, great. If they've got to take 4 to 5 buses along with the 2 children that they have, not so great. So I think we always have to keep that in context. That health is not only just a physical presence; it's a mental and a spiritual presence. And so I want to kind of discuss also what I think the care of the future will bring in. And I think that one of the things that's what artificial intelligence or AI is going to bring to the table. And when I think about artificial intelligence, my first discussion is about how the computer takes over. I think it's the 2001 Space Odyssey or something like that, a few years back. But again, that's not what that is. I mean, that's what it is for most people, but that's not what it is. And so the use of an AI as a tool in making better diagnosis and explaining to patient risk. So the concept, I think, is that we're moving from risk-based medicine to healthcare promotion, prevention, being proactive versus reactive. And what that means is that, we want to prevent problems before they become problems. So thereby, the whole discussion around screenings, about, preventive vaccines, about understanding your risk issues. And what I mean by risk issues is that you can't control age, sex, race. And I would say environment's an issue in it too. But you can't control those factors. You are what you are. You are born, decide what genes you're gonna have. And so that in there lies the discussion, is that if we are genetically predisposed to certain conditions, then what is our best bet of, one, having those conditions, if we can avoid it, prevent us from getting them, or if we get them, we're able to manage them in a more efficient manner as opposed to an acute issue. Example, heart attack and stroke. So I'm betting my career on this model. It's the model I've been pushing. It's the model I'm advocating for. And I think that we'll see in the next couple of years what we'll make of that. But that being said, I have the unique opportunity to watch a very intelligent Black man at work do his job, and do it in the style of someone who understands human suffering. And so Dr. Michael Noor is that person. And as we started to collaborate and talk about what this might be in terms of a community setting, we knew that, one, we would have to utilize social media, but as well as give people access to either short bites of information in terms of the health minute, or larger bites of information, like what we are going to do and what I've been doing for the last few years now. So we'll see how it plays out. I think that, as you start to access the websites of mine, and his education is bestmedicine.com, and he does blackdoctor.org, and I will make sure you get that, because it's really interesting, and it's one of the things I'm highlighting today. And so BDO, Black Doctor Org, it's an intellectual undertaking in regards to expressing discussions about people of color, not just people of color care, but care in general, and particularly as it involves us. So some of the articles that are aligned is the plight of dual non-eligible people in the United States. Approximately by 2030, approximately 1.1 million older adults with low incomes in the United States will be ineligible to enroll in Medicare or Medicaid because they are undocumented immigrants. So some of the discussions that we have to have, right, discussions around in our populations, what is affecting them, of course, access to care, of course, providers that look like them, of course, low cost medicine, of course, people that are empathetic and sympathetic to the issues and needs, of course, now case care management, and of course, looking at the global nature of people's health in their environments and how it affects them at an individual level as you assess, and in my case, try to evaluate folks. So, one of the other articles in the discussion is racial disparities in maternal mortality and the impact of structural racism and implicit racial bias in pregnant Black women. I'm going to get you the website because I think everyone needs to be able to read these kinds of articles and for themselves. We've been talking about racial disparities and infant maternal mortality, the mother dying, right? And the impact of structural racism and implicit racial bias on pregnant women. So we said this is not just a issue about a woman of color not getting prenatal care. In most cases, she gets prenatal care, but it's not the care that's individualized to her social circumstance, and understand she as a woman. In other words, wants her to bear this child out. So I think there's some structural issues in medicine And I had to call it post-COVID, where I saw providers leaving, not because they couldn't practice. It was they saw the future and who they would have to take care of, and they didn't want to do that. Do I have proof about it? No, I don't. But is it a good call? Because we do lack providers. And, again, my first epidemic was HIV/AIDS. And you didn't have the number. You had providers not wanting to see patients that had HIV/AIDS, but you didn't see a mass exodus from health because of it. They just didn't see patients that had HIV/AIDS. That changed legally, and from, again, the discussion that we're having now. But it was an advocacy for a patient care group that was being affected by, structural and institutional racism. And it's a good article. Just so that I'm on this, the website is blackdoctor.org. And I thought I had it, but let's see here. And I think it's just it's blackdoctor.org, capital BLCK doctor.org. And I'm sure if you put it into the search, you'll come up with it. But it's a great insight. And again, we're going to uplift these kinds of sites for people to put their eyeballs on and go through the information and comment on them. We want to see folks increasing their activity in terms of accessing these particular sites and getting some information, quality information that really speaks to you and your condition and who you are. So, and it just gets a great wealth of COVID-19 vaccine hesitancy among Black women in the U.S. So, I mean, these are kind of discussions that, you want to have. And I think that, again, it's www.blackdoctor.org. And I would put the site up, but I'm not that good at doing this yet, so I got to learn that one. But it's www.blackdoctor.org. And it's on all social platforms too. So would love you to check it out. It says, and what he says, it says the site will be at the top of everything because as a community, health is our biggest asset, and you will need to help. You need help to protect it. And I think that's advocacy, and I think that's a way of looking at things. So, but the article I chose to kind of take a look at and have a real discussion about, because I think it's his op-ed piece. The op-ed piece is on the top of his mind, and so again, and I know it this in my Facebook post. It says the apology, and so this is what he says, and I'm really happy he says it. It says, once again this year, we as doctors/providers need to apologize for our part contributing to one of the worst healthcare systems. And he notes that life expectancy in the U.S. is just about 79.2 years, ranking us 40 globally. And the question is, well, if we're ranked 40th, what nations would you consider to be third world or developing? What nations came above 40th in terms of life expectancy? So, thank goodness for GPT chat. And I said, I posed a question that was posed in the article. Life expectancy in the U.S. is just about 79.2 years, ranking the U.S. 40th globally. And I asked, what 5 countries would America, particularly African Americans, would think about them being ahead of. I mean, so if you look at the third world country, you could say, gee, the U.S. is 40th, but they are ahead of us. It says, it's an interesting question, GPT chat said, and I thought it was too. It says, consider, especially in terms of how countries are ranked by life expectancy and their developmental status. Life expectancy is only one measure of a country's overall well-being and development. But I understand you may be looking at the countries that rank higher in life expectancy, yet might still be classified as some other developing or lower income countries. Exactly what I was looking for. And it's so there are 5 countries that have higher life expectancies than the U.S., but would still be viewed as developing in certain contexts. Costa Rica, life expectancy 80 years. Remember, America is 79.25. Costa Rica simply has one of the highest life expectancies in the world, partly due to its focus on healthcare and environmental sustainability. Despite this, it is still classified as a developing country with ongoing challenges in some rural and lower income regions. But Costa Rica, right? I'd like to thank Jesse Collins for watching and Kevin Scott for watching. Thank you, folks, for watching. Appreciate all the folks that watch and share. Please share the shows, please. And when you see the health minutes, share those too. Again, we're trying to develop content that is for and by us to us. So Costa Rica, right? Malaysia, life expectancy 80.5 years. Malaysia has made significant strides in healthcare and infrastructure. While it is considered a developing nation in some areas, it ranks higher in life expectancy than the U.S., reflecting a strong healthcare system and growing economy. Malaysia, right? Sri Lanka, life expectancy 79.5. So, equal to or better. Equal to. Sri Lanka is an island nation in South Asia that made impressive improvements in healthcare outcomes, particularly for women and children. Though it still faces economic challenges, it has a life expectancy compared to or higher said than the U.S., yet remains a developing country by most standards. Vietnam, wow. Good morning, Vietnam. I thank all the American men that lived and died and was traumatized by the Vietnam War. I was a Vietnam War veteran. I did not go to Vietnam, but, the psychological and social traumas of a war that probably shouldn't have been fought. Now, in hindsight, right? It's something devastating. A lot of African-American men went to Vietnam also. Vietnam has experienced remarkable economic growth over the past few decades. Despite still facing certain challenges of the developing nation, is one of the highest life expectancies in South Asia across the effectiveness of its healthcare system. It's again, what you see, healthcare system, promotion of individuals in terms of getting healthcare, standard of care. All those things count when you're trying to keep people alive. Well, again, and it's not just keeping alive, but it's the quality of life that you want to be a part of. So quite interesting, right? Life expectancy, we rank 40th, and then we have a number of countries, at least 5, that would be considered developing, that you get you can live longer. Isn't that interesting? I just think it's crazy. So since we have GPT, I said, what is the life expectancy of African Americans in the Bay Area? Now, we got we're getting real local now. And I always want to provide a context of a global context versus a localized context. Let's see what they said here. If I can get the play. Okay. This says the life expectancy of African Americans in the Bay Area, like in many regions, can vary depending on factors such as socioeconomic status, access to health care, education, and other social determinants. Social determinants are food, clothing, and shelter, those kinds of things. While specific data for African American in the Bay Area might not be readily available, we can look at the broader trends in California and the country. Generally, the life expectancy of African Americans has been reported to be slightly lower than that of white Americans, often due to factors such as systemic health disparities, racism, right, economic inequality, limited access to health care. In California, the overall expectancy is about 81 years, but for African Americans, it may range from 74 to 78 years. Why did I bring that up? Because 5 countries that are considered low-income poverty countries have a higher life expectancy than African Americans in the Bay Area. I think that's chilling. Absolutely chilling. In the Bay Area specifically, which has some of the country's best hospital and healthcare system, African Americans may experience slightly higher life expectancy compared to national average due to better access to medical care. However, they still face challenges related to healthcare access, housing, affordable environmental stresses that could impact health outcomes. Local health initiatives and public health campaigns are always working close to those gaps. So, thus my philosophy about care and why I've approached care from this aspect. Because we have to. We just have to take better care of ourselves, have the information at hand, utilize the information, understanding the issues around food choices and exercise and stress and environment that affect our health. Not just us being bad people, not wanting to take care of ourselves. So that is a interesting piece. Excuse me. And so in the next part of the article, and again, I'm taking snippets of the article. You can go and read it on blackdoctor.org. Again, and catch some more of the nuggets that are on it. Great stuff. It says these countries might be considered developing by some standards due to factors like income inequality, economic disparity, or certain infrastructure challenges, but they show that life expectancy can be influenced by many factors, not just overall national wealth. My point. Although we are spending so much on healthcare systems, Joyce Elder talked about this too. One of the last, a recent African American Surgeon General, about the structural issues in race, in racism, in care, and how it affected us, and just structural issues. So example, so life expectancy can be influenced by many factors, just not overall national wealth. My point is, it's not how much you spend, it's how you spend it, and spending quality and spending targeted and directed, and with discuss that I want this group to get better. Well, and this is why the removal of DEI, I think, is really kind of a slap in the face. If the only way you can get equality is to have a law, then you take that law away, then you never wanted to have equality in the first place. DEI, right? Diversity, inclusion, equity. So African Americans in general, looking at life expectancy across the globe, can sometimes be highlighted health disparities. Again, it always exists, right, between healthcare and environmental factors and socioeconomic disparities. And it said, well, I was right. Dr. Lenore was right. You're right to point out the U.S. spends a significant portion of its GDP on health care, yet falls short in healthcare outcomes. Again, outcomes. It's not how much money you spend, it's the outcomes. is that people die more or less. So why I look at the two pots in healthcare of heart disease and cancer, because those are the things that are going to kill you. That's more risk of dying from that than getting shot or getting run over by a bus, or dying by an animal or a partner. Okay, it's a risk issue. So this gap can be frustrating, especially when you consider how countries with lower levels of healthcare spending or research still manage to outperform the U.S. in some critical health metrics. The concept of developing a third world country can be problematic, but in the context that we're talking about, let's look at the 5 countries that are often considered developing lower income nations but have better outcomes than the U.S. in terms of expectancy and preventable deaths. I think that's a good metric, right? So if the point of a system is that when you coming in the system, if you are injured, you leave the system better and more able to function, or it limits your risk of death and disability, or it is economically doesn't bankrupt you, then that's a good system. Anything else is not. So here's the 5 countries that are considered developing or low income nations, but the outcomes, but have better outcomes in the U.S. in terms of life expectancy. Remember, this is the U.S. This is the best quote unquote healthcare system in the world. They spend more money than the world. And if you're for cuts, there should be targeted cuts, not just a meat axe approach to it. So one of those countries was Cuba. Life expectancy 79 years. Despite its status as a developing country with limited resources, Cuba has one of the highest life expectancies in the world. Its healthcare system offers praise for its preventive care approach and emphasis on public health, which leads to better outcomes in areas like maternal and infant mortality and chronic diseases. I submit to you that it's not that we can't fix it. We've made a choice not to fix it because this makes this a less economically sound option. It makes the healthcare system not as much needed. So in reality, when people heal themselves, then the system takes a hit. Even at 25%, I was told there's 25% of people get sick. Don't worry about it. 25% of the population will be sick. And why is that? We should want none of the population sick. We just don't predetermine 25% people are going to be sick. Really intelligent people too, said this. Really intelligent people. Rwanda. Oh my goodness. So we have Cuba, now we have Rwanda. And this is Believe Radio, 24-hour inspirational gospel music station. Want to thank Isaac Conscious Soul for allowing this time slot. Look, I'm a consistent person. I try to be consistent, and I want this venue to grow. I think it's needed. We need voices to speak to us about us. It's okay. And Douglas Sanders, thanks for Shabbat. I loved your bow tie, by the way. That was really, really classic. My goodness. Got love for a lot of people that have been through me in this journey and have taught me and had me learn and made me humble and made me see things I didn't see before. So I'm very blessed to have those people that kept me grounded. My family, my children, all those folks. So Vietnam again. Wow. Vietnam is just, Vietnam's healthcare system has improved dramatically over the last few decades, a couple about 20 years, right? And it has a higher life expectancy rate than the U.S., even though it is considered a developing country. The focus on primary care, immunizations, community health-based interventions has contributed to a lower rate of preventable diseases. Quite important. Thanks, Melanie Howard. Quite important that we understand that we have countries that are considered third world doing less with more and having better outcomes than those where they're spending much more money and not getting the benefit. I see it all the time. And just easy stuff like blood pressure. We have to be able to control blood pressure. Target blood pressure is 130/80. There are a number of ways that you can control blood pressure, but the best is total lifestyle changes. Why? Because hypertension/heart disease is a preventable treatment to prevent people from having heart attacks and strokes. Preventable. Not have the stroke, not have the heart attack. Get prevention in your brain. That's why you diet. That's why you exercise. That's why you decrease the stress. You want to prevent this. You don't want it to have such an impact on your life that it changes the game for you. Yeah. So anyway, Sri Lanka again. These are supposedly underdeveloping countries with less economic resources that are performing better in the American healthcare system in terms of definable metrics, life expectancy, outcomes, better maternal care, better children care, because they care. Sri Lanka is often cited as the model for improving health outcomes. I always think that, they send these large boats out, they go and take care of kids with, really weird opacities and dental issues, and they should do the same thing. Just turn around and just go through all these urban neighborhoods that need it. That would be really saving somebody. Thailand, again. Thailand is a developing country that has made great strides in healthcare access and disease prevention. The Thailand government's universal coverage scheme has increased access to healthcare for all citizens, leading to improved life expectancy, reduced preventable deaths, despite its classification as a developing country. And I would say that the third rail now in America is the Affordable Care Act. I don't call it Obamacare. He's of the Affordable Care Act. And more people are signing up for health care because they realize the need to be in a system where you go to the system and you get treated and get a relationship, because going to the emergency room is expensive and sometimes the outcomes aren't what people want them to be. So we are moving to a preventative mode. We have to be proactive as opposed to reactive. And so one of the themes of some of these countries, as GBT Chat said, emphasis on primary and preventive care, and that happened in Almaty, in which in Russia, they had a whole major conference on healthcare systems and what was needed to, if the ideal system take place. This also takes place in primary care now, and with the WHO, and I think it's Dr. Chen, female, who took over the WHO, and just propelled it, just accelerated the dialogue around primary care access. Nice lady too. Emphasis on primary care and preventive care, affordable care for all. Boy, that sounds radical. Whether through government systems like Cuba or Thailand, free public health care, as in Sri Lanka, these nations ensure that more of their population can access the healthcare service, because prevention is worth the pound of cure. Treating the high blood pressure as opposed to treating the issue of heart attack and stroke or cancer. Again, back to cancer screening. That's why the cancer screenings are on. Whether you believe it or not, they're proactive versus reactive care. At least you would know that you had a prostate cancer, that you had a lung cancer, that you had a colon cancer, that you had a skin cancer. So for African Americans or other marginalized groups in the U.S., looking at these countries may underscore some of the structural health inequities presented in the U.S. system, where factors like, this is just plain true, this system has not been balanced. It has not been fair. And with the removal of DEI, it says that nothing matters but that you get the care, not the care that makes you well, just that you're provided care. And that's a whole different, there's a whole issue between getting medicine and being provided care. Care uplifts you and makes you feel good leaving that visit versus downtrodden, angry, and that no one listened to you. And that's my hardest job because they want to squeeze your time. And I have to sit back and say it's not that important. I've got to have all the information. I have to talk to you. You have to feel what you have to see the big pop, heart disease, cancer, and how we go to screen for it. And then it's total lifestyle changes. It's the food, it's the clothing, it's the shelter, it's the plant-based foods. It's reducing the sugar and the salt. That's a conversation that you have. And I live it, you know. I'm a fruit shake guy. Because sometimes I can't take a break, can't take a lunch. You know, that's okay. Another thing. And they also focus on maternal and child health. Several of these countries have made major strides in reducing maternal and infant mortality, which have been a key factor. So why doesn't America go to these countries and find out how, after 30 years, Black babies and Black mothers and women of color and folks without access are dying in childbirth? Ask me why track star Miss Bowie died in childbirth. In fact, two of the members of the track team, the world track team that she ran on, had maternal problems in bringing children to term. These were athletes. So something's not here. Something's not right. That's the structural issue. That's the intergenerational racism in the healthcare system. And what I mean by that, you can go back and look at dynamically how cattle and chickens and any kind of animal had better station in terms of getting health care than a African American slave at that time in 1619. So it says another piece that Dr. Noor brings up. Again, this is his op-ed piece. Great piece. Go read it. It's really it's thought-provoking. You know, he's a thought-provoking physician. He's had some time. He's had some years under his belt. One thing his wife, Ms. Lenore, thank you, Ms. Lenore. She is also the clinician. They both have been a husband and wife team and just knocking it out the park. Way to go. And I want to thank the frontline staff, Makita at the frontline staff. Just a Herculean. Thank you. You do so much good work. Don't let nobody tell you different. That being said, it says that so in the article it said if unaddressed, these issues will cost the U.S. 4 years of life expectancy gains by 2050. I already told you to be in the Bay Area. We're already down a few years. So, and for the Bay Area, and I would say broadly, for people of color, they have life expectancy rates less than 4 the 5 third world countries. In a system that's supposed to be one of the most expensive and most money spent system in the world. Joyce Elder called it the best sick care system in the world. The best sick care system. These black women have it going on. They just got it going on. They got it going on. Got it going on. Anyway, so in the article, it says, and this again, the snippets of it, if unaddressed, these issues will cost the U.S. 4 years of life expectancy gains by the year 2050 and result in 12 million preventable deaths. So 12 million preventable deaths can be, it can't be prevented because we're not doing the things we need to do. This isn't a healthcare crisis. It is a system that prioritizes profits over people. 5 countries, I said 5 countries, and that's 5 countries with America, particularly African Americans who are here considered third world developing about, this issue. And so GBT chat, again, do your homework, do your research. He says you're absolutely right to emphasize how systemic issues in the U.S. healthcare system, such as prioritizing profits over people. Thank you, Dr. Lenore, for mentioning. Dr. Lenore is a very conservative Black physician, and but by no means ignorant, or by no means unable to see things in front of his face and comment on them. So I appreciate that. We need more of him. Are contributing to a stagnation of health outcomes, including life expectancy and the family, of course. And if these issues aren't addressed, they could indeed have a profound effect on the nation's future health. And as mentioned, with the projection of lost life expectancy, again, 4 years of life lost by the year 2050. And that's 12 million preventable deaths. Somebody's mother, somebody's sister, somebody's daughter, somebody's first child, somebody's aunt, uncle, grandparents, LBGT partner, somebody. You know? So what are the 5 countries? Because again, I just want to emphasize that not that America ain't so great. It ain't so great. It's okay not to be great. You know, gee, we're not doing this. We can do this better. Not refuse to understand the information, the data, to dismiss it, to have websites go dark because the information it provides isn't consistent with your values. The books you read aren't consistent with your values. Again, the loss of education science, that paradigm. So, looking at the 5 low-income countries and life expectancy, preventable deaths, Cuba, basically the same list. You know, Cuba, Rwanda, Vietnam, Sri Lanka. Again, universal health care, structured, targeted approach to care, you know, treating preventable diseases, that kind of thing. That's what gets healthcare done. That's what we need. And why does this all matter for African Americans? For the factors are, again, GTD chat, universal health care, focus on preventative care, investment in public health education, equitable access to health care. Well, DEI says that, brings that to a fore. So we have to have access, has to be equitable, has to be equal in order for it to be successful and for us to get higher rate of return on our money. But yeah, if you don't want to do that, if all that social conscious stuff about who runs, who controls, and what your rights are, or the rights that I give you, then we're in a different discussion. Like we're reading a different book. So what does this matter for Africans, African Americans? For African Americans, these disparities are particularly concerning health inequities due to factors like systemic racism, economic disparities, and limited access. Hey, I'm not going to change my tone. I can't change and talk about it because that's just what it is. I can't stop talking about that. I'm not going to stop talking about that till it changes. It affects the care that I provide. So I have to context my patients I take care of by telling them we're on a journey together. And there's going to be some stops and some bumps along the way, but the end to that journey is good health, access to both physical, medical, and mental health services, patient choice, shared decision-making, patient/person-centered care, trauma-informed care, focused care, and do no harm. Do no harm. A lot of harm been done to us in the system. I'm sorry folks don't want to accept that, but it is. This housing issue, all these things are as old as California. Redlining, old as California. So it means that African American communities face higher rates of chronic disease as diabetes, hypertension, and heart disease. This is exacerbated by the U.S. healthcare system's tendency to prioritize profit over patient care. Thank you, Dr. Lenore. Which I'm saying thank you because in the GPT chat, it constantly hits prioritizing profits over patient care in its answer. Curtis Thomas, thank you very much. Appreciate you, man. Appreciate you. Hey, he's a man. He's the man. He runs it. He runs it. This provides a clear indication of how U.S. could improve its healthcare system by learning from these nations and rethinking its priorities. Do you think that's going to happen in these times now? I wouldn't bet on it. I would not bet on it. So the solution that we have is not attainable because it moves away from DEI, diversity, equity, inclusion, and moves more toward loyalists and those that would do the bidding of those that are being told that, like sheep to slaughter. Says beware wolves in sheep's clothing, right? Interesting concept. Black Americans have a life expectancy nearly 5 times shorter than white Americans. This is from Dr. Lenore's article again. It's 72.8 years versus 77.5 years. Again, Oakland, Bay Area, you hear me? More than twice the infant mortality rate, 10.6 versus 4.4 per thousand, and plus the mothers die too, right? Are nearly 3 times more likely to die from pregnancy-related causes, 39.9 versus 14.1. Again, almost 40% to 14. These disparities stem from systemic racism and pseudoscience that falsely claim that biological race differences. What 5 countries would have America, particularly African Americans who are ahead of us, consider third world developing? That question again, I keep asking. It's 4:47. I want to thank you guys for hanging out with me. I want to thank Miss Howard as she does her thing. Always in the community, always doing what she do. She'll be back next week. I want to thank Curtis. I want to thank Amology. I want to thank all the folks that make it possible. I want to thank my Facebook family. We are blessed. We are powerful. We are strong. We are who we are, and nobody can stop us. Ain't no stopping us now. Right. Anyway, it says, so the response to GPT chat and all this kind of stuff. The disparities you have outlined, such as the shorter, thank you, Dr. Lenore, for shorter life expectancy, higher infant mortality, and higher pregnancy-related deaths for Black Americans, not Black African American / Black Americans, are stark examples of how systemic racism and socioeconomic. I guess I would say that blacks coming to America from another country start to experience the same things prior to being in that country. That's why they go back home and get recharged to come here, because you have to fight the racism, the institutional structural racism. What about when you don't have a place to go, a place to rest your head? Social determinants of freedom and peace are stark examples of how systemic racism and socioeconomic inequalities shape health outcomes. These differences in health outcomes are not just the result of individual choices or behaviors, but are deeply rooted in structural racism, historical injustice, and discriminatory policies that persist in the U.S. healthcare system. It's frustrating that these disparities persist despite the U.S. spending more on healthcare than any other country. That is too deep. That's why I use GPT chat. Because that's true. Even though they spend more, they have worse outcomes because their heart ain't right. They're not thinking about us. We're not thinking about them. We're scared of the system. It's traumatized us. Ask Henry L. Lax's family about trauma. Ask the Tuskegee Institute, the Tuskegee Syphilis Studies. Ask those families what the healthcare system has done to them. It says, looking at this in context, it's important to acknowledge that while the U.S. is considered a wealthy nation, it lags behind many countries, especially developing nations, in terms of outcomes of Black Americans slash African Americans. Why I keep making that point, and me and Dr. Lenore had this discussion, that 1619 versus becoming a Black African that comes in is a totally discussion for 300 years if you're under that oppressive system called chattel slavery. If your ancestors every 100 years have to deal with that, being imprisoned, being traumatized, being raped, being set apart, never could watch Roots. Too real for me. Intergenerational trauma triggers me. And for those that can watch it, fine. I can't. So looking at this context, it's important to acknowledge that while the U.S. is considered a wealthy nation, it lags behind many countries, especially developing nations, in terms of outcomes of Black Americans / African Americans. Here are 5 countries that, despite being considered developing nations, have better health outcomes in areas such as life expectancy, infant mortality, and maternal health. You know the drill. Cuba, Sri Lanka, Rwanda, Vietnam, Thailand, same ones. Okay. And so, in last part of the article, and again, I want to thank you folks for tuning in. Ms. Howard will be back next week. It says, because this comes out of the article, thank you, Dr. Lenore. These disparities stem from systemic racism and pseudoscience, the falsely claimed biological racial differences. Racist beliefs shape policy, media practices, and public attitudes for centuries. I say that because in 2016, I'm at Stanford in 1980, and went to the hall, and this gentleman named Shockley, Dr. Shockley, was having a discussion around Black people and their brain size and their intellectual capabilities at Stanford. It says a 2016 study found many white medical students in Russia still believe myths like Black people are having thicker skin or faster blood clotting times. Racial biases continue to influence medical education, clinical tools, and care. Most recently, the pulse ox undervalues the oxygen saturation rate because of the way the machine is made. True discussion. So when you get your little finger test, it's probably a different value if you're African American or a person of color. Racial biases continue to influence medical education, clinical tools, and even care, driving inequities. How did these beliefs originate, and what the role does cognitive dissonance, I asked that, play? He said, you've raised a crucial point about the deep-rooted and harmful effects of systemic racism and pseudoscience and healthcare disparities. The presence of racial bias in medicine, such as the false belief that Black people have a thicker skin or faster blood clotting, is both disturbing and dangerous. These beliefs not only impact medical education, and clinical care, but they perpetuate health inequities and contribute to the mistreatment of Black Americans, particularly in healthcare settings. To understand how these beliefs originate and how they continue to affect outcomes, it's important to look at their historical foundation in the psychological mechanisms like cognitive dissonance to keep them alive. Origins of racist beliefs in medicine. The roots of racist beliefs in medicine can be traced back to the period of European colonialism and transatlantic slave trade. During the 18th and 19th centuries, European scientists, doctors, and philosophers sought to justify slavery and the exploitation of Black people by promoting the idea that Black people were biologically inferior to white people. These pseudo-scientific theories are often referred to as racial science or scientific racism. And and they were used to create and perpetuate false distinctions between race. Phrenology. This was a study of skull shapes to justify racial differences, Dr. Shockley. It was used to argue that black people's skulls were shaped differently and they were a sign of inferiority. Physiological theories. Pseudoscientists claim that black people could have different skin, blood, and other physiological differences that made them less capable of feeling pain or suffering, which was used to justify their exploitation. Eugenics, a movement that gained popularity in the early 20th century. Eugenics promoted the idea that certain races were genetically superior to other races, leading to the discriminatory practice, immigration, marriage, and even forced sterilization. Understand that Adolf Hitler believed in eugenics. The German people were inherently better than anyone else and greater than anyone else, and therefore the third rank would live for 1,000 years. This pseudoscientific belief became embedded in medical practices and leading to the normalization of unequal treatment and based on race. For example, black patients were often denied pain relief during surgeries or childbirth because doctors falsely believed that black people had higher pain tolerance. Similarly, black people were disproportionately subject to experimental treatments and unethical medical research. The example is the Tuskegee syphilis studies. Cognitive dissonance. And we're almost out of here. It's been great. Thank you guys for coming through. I appreciate you. Cognitive dissonance is real. Cognitive dissonance is psychological discomfort that arises when one's beliefs conflict with the actions of new information. Joyce DeCurie, Dr. Curie describes this in her book, Post-Traumatic Slave Syndrome, now a disorder, and her sentinel work on the subject. And here it says that it plays a significant role in perpetuating these harmful beliefs and practice. Here how it works. Confirmation bias. People tend to seek out information that supports their existing beliefs and disregard information that contradicts them. For medical professionals with racist belief, a conscious or subconscious, they might selectively notice evidence that aligns with stereotype belief that black patients feel less pain and ignore evidence that contradicts those stereotypes. Justifications of inequality. When confronted with evidence that disproves racial or social racial disparities in healthcare outcomes, some individuals may experience cognitive dissonance. To resolve the discomfort, they may rationalize or dismiss the evidence, further reinforcing racist beliefs or practices. For example, if doctors or present with research showing black Americans have worse health outcomes due to access to healthcare, instead of acknowledging systemic racism, they might attribute the outcome to inherent biological differences or personal behaviors or preserving the status quo. Implicit bias. Cognitive dissonance can contribute to the persistence of implicit bias in healthcare. Medical professionals may hold racist stereotypes subconsciously, leading them to make decisions that align with their biases. Even if they constantly reject racism, the discomfort caused by these biases can contribute to some people avoiding addressing these together. Thomas Jefferson was a unique discussion around cognitive dissonance. Read about him in Sally Hemings. Read about the young black female in his concubine at the White House. Just didn't get started. It's been going on since 1619. I want to thank you guys for coming in, hanging out with me. I want to thank Ms. Howard. I want to thank the staff and crew. I want to thank the world. I want to thank the folks down at Victory Mazda. Thank you. Good guy. Good staff. I think it's so exciting. We're in an exciting time. I think the Chinese say, "Man, you live in interesting times." We are living in those interesting times. How will you embrace? How will you interject? How will you make your mark? Dr. Lenore and I are putting together a discussion about how we're going to do that. We're going to keep it moving. Please support Black media. please support the information that speaks to you and your culture and where you're at. Not to disparage anyone else, but we have a unique history. We have a strong history. We have a powerful, powerful legacy to protect. I want to thank my granddaughter. I want to thank Tracy and her husband for taking care of my grandbabies. I understand I have a new granddaughter now somewhere in Reno, so we'll figure that one out. You know, I don't know why the grandchildren don't want you to see your grandbabies. Huh? Maybe something you're doing, right? I take my blame. Anyway, I'm not the best person, not the perfect person, but I try to be the best person I can for that day. Amen. Again, thank you for coming through. And we look forward to seeing you next time.